Hello everyone, my name is Leilah Alkadi and this is my oral presentation on the Spanish flu, which is an infectious disease. What is an infectious disease, you may ask? It is any disease that is caused by the direct effect of a pathogen, and those pathogens can be cellular or acellular. Cellular pathogens are bacteria, parasites, and fungi, while acellular pathogens can be viruses, viroids, and prions. Anyone can catch an infectious disease from other people, contaminated food, water, soil, or bug bites. The Spanish flu was an extremely dangerous infectious disease, and it was caused by a virus, making it an acellular pathogen. Viruses are pieces of information of DNA or RNA that are inside of a protective shell called a capsid. Viruses are much smaller than our cells and do not have a way to reproduce on their own. Viruses need a host to copy themselves. Once inside the body, they use the body's cells' machinery in order to copy themselves. How does an infectious disease like the Spanish flu spread? Well, there are many ways for pathogens like the virus of the Spanish flu to enter your body. They can enter through your mouth, nose, or a cut on your skin. The Spanish flu can be contracted from person to person by a cough or a sneeze. This is because there are droplets that can linger in the air afterwards. Close contact with another person, like kissing, can also spread the virus. When touching the same surface as someone infected, like a doorknob, phone, or countertop, that can expose you to the virus. Bites from mosquitoes who are carrying the virus could also cause a person to contract the virus. Specifically, the Spanish flu spread due to World War I's armies and navies. Traveling in close quarters of boat and train aided in the spread of the Spanish flu. During the war, 40% of the U.S. Navy and 36% of the U.S. Army became ill with the Spanish flu. What was the Spanish flu? The Spanish flu had an avian origin, meaning that it started in a bird. It was a pandemic caused by a new influenza A virus that was highly contagious, spread easily, and infected people all over the world. Since the virus was so new, few people, if any at all, had some immunity to this new influenza strain. In that time, the Spanish flu had infected around 500 million people globally. Between the years of 1918 and 1920, that was around 33% of the world's population. In just 2 years, it had infected 500 million and took the lives of 50 million. Symptoms of the Spanish flu were very similar to the more common flu symptoms we keep an eye out for during our usual season, except the Spanish flu symptoms were more severe than the common flu. The danger of the severity of the symptoms of the new flu strain was not well known to the people. Most people had just assumed that this new flu strain was just as much of a nuisance as every one before it. Not knowing how deadly and highly contagious this flu was, an approximate 20% of those infected with the Spanish flu experienced a mild version similar to the common flu, but the remaining 80% experienced more intense flu symptoms such as fever, severe body aches, combined with respiratory problems lasting a few days to a week or more, resulting in their death or a lengthy recovery. How did they diagnose and treat this dangerous flu strain? Well, since the Spanish flu was an entirely new strain of the flu, there were no tests for the virus yet. Doctors and healthcare providers had to rely on patient symptoms for diagnosis. Since there was also no vaccine for the virus, The primary precautions put on by states and the government was to ban public gatherings, shutting down schools, churches, and movie theaters. Their thoughts on a best plan of action to help prevent more spreading was a partial lockdown. Military personnel were told to gargle salt water since the virus was thought to be spread by throat and nasal mucus. How did they attempt to prevent the spread of the Spanish flu? There was no specific prevention methods against contracting Spanish flu. Some communities had decided to enforce certain measures. Those measures included isolating oneself at home, closing schools and gyms, washing one's hands thoroughly and often, wearing a mask at all times when out in public, and to not spit in public, since at the time they had believed that this flu spread through respiratory mucus. What exactly made the Spanish flu so deadly? The lack of effective treatment at the time of the Spanish flu was due to the fact that the virus was unknown. Militaries, families, and animals were all living in cramped settings, and this was all due to World War I. The shortage of healthcare providers was also due to the war period. Most doctors had been drafted to go and fight for their countries. The new virus strain of the Spanish flu had an exceptional ability to mutate and infect the lungs. All these factors helped make the Spanish flu so deadly. What finally brought the Spanish flu pandemic to an end? It began to trail off in late 1919 without the knowledge of why it did. There were no vaccines. But when enough people grew immune to stop spreading to new hosts, the Spanish flu pandemic died down. Herd immunity, or active, naturally acquired immunity, caused the new deadly virus to mutate in order to keep spreading. The new mutation of the Spanish flu was less dangerous and less deadly, bringing the pandemic to an end. The Spanish flu is the deadliest influenza virus the world has ever seen, an infectious disease caused by an acellular pathogen which took the lives of 50 million people globally until its mutation, which ended the 1918-1920 pandemic.